Brown-Sequard syndrome is a condition which results from the damage or resection to one half of the spinal cord on either side. This hemisection causes damage to the spinal cord tracts, which are the pathways for transfer of information to and from the brain. This syndrome results in weakness or paralysis known as hemiparaplegia on one side of the body and a loss of sensation known as hemianesthesia on the opposite side. In the spinal cord, we have the posterior horns, which contain the cell bodies of sensory neurons, and the anterior horns, which contain cell bodies of the motor neurons. In the white matter, there are myelinated axons which are arranged in form of tracts. The lateral spinothalamic tract carries the sensory stimuli such as temperature and pain, while the anterior spinothalamic tract carries sensory from the crude touch. In the ascending dorsal column, we have the fasciculus gracilis, which carries the sensory information from the lower trunk and the legs, while the fasciculus cuneatus carries sensory information from the upper trunk and the upper limbs. A sensory stimuli passes through three neurons, that is, the lateral branch of the first order neuron, which carries the information to the dorsal root of the spinal cord, and then synapses with the second order neuron, which crosses to the opposite side of the spinal cord and travels the brain, where it synapses with the third order neuron located in the ventral-posterior region of the thalamus, which then transfers the information to the postcentral stylus for it to be interpreted. Brown-Sequard syndrome is caused by either a penetration trauma such as puncture wound on the neck or the back, ruptured disc, ischemia or obstruction of blood vessels, or sometimes infectious or inflammatory diseases such as tuberculosis or multiple sclerosis. Hemisection often occurs in the cervical spinal cord, and it is rare for the entire hemisection to be affected, but mostly there is incomplete hemisection. The signs and symptoms of Brown-Sequard syndrome are: we have loss of pain and temperature contralaterally from the body regions from the affected dermatum downwards, and then we have a small region of bilateral loss of pain and temperature at the level of the lesion and two segments below. Then motor effects such as ipsilateral spasticity and weakness of the muscles, and loss of fine discrimination such as touch, vibration, and position sense ipsilaterally from the body regions from the affected dermatum. This one makes the patient unable to distinguish vibration or touch. The diagnosis of Brown-Sequard syndrome is made by an MRI